Hi guys, it's Dr. Naidoo. So we're going to go on to our next lesson, which is talking about warning signs for suicide in youth. So let me share my screen and let's get started in our What Do I Do workshop. So in this lesson, lesson 4, we're going to go over some suicide warning signs. We're going to follow the American Foundation for Suicide Prevention chart. We're going to look for the warning signs for 12 and above, as well as the warning signs for ages 12 and below, because they do overlap, but they are a little bit different. We're going to talk about when these warning signs do occur and what to do about them if you do see them. How do you know if it's a problem or just a blip or a phase? And I'm going to help you use the acronym FIND, which is something that I created to help you identify when this might be a problem or not, and bring that to the attention of your medical provider or your mental health care provider. And then finally, our know better, do better bullet points. So let's begin. This is a chart that's come up from the American Foundation for Suicide Prevention. I find it very helpful because it is colorful and really divides the warning signs into 3 components: the speak, what they talk about, the mood that they are experiencing and endorse, and then the behavior or the action that you observe. So we're just going to read through each of these. And I want you to ask yourself, when you think about your teen, do you see any of this? Have you seen any of this? And if you have, how long ago? So the first thing we'll cover is in the pink, the mood. The first thing, of course, that comes up is depression. Do we see a young person that has depressive symptoms, is more withdrawn, is more tearful, is more irritable? That is another symptom here, which can be linked to depression as well. Are they more hopeless? So these are some symptoms of depression to look for. Then we have irritability. When we think about irritability, irritability is related to anger, but a bit different. It relates more to how someone presents and reacts when life comes at them. Do they have an underlying an underlying poor frustration tolerance, anger? That is more like irritability. Another symptom that we look for in mood is humiliation. Are these people very embarrassed? Do they feel ashamed of themselves? Are they easy to be shy and bashful and avoid others because they don't want to be made fun of or poked fun of or get shamed very easily? So humiliation. Another mood symptom is rage. So that's on the other end of the spectrum with anger. It's explosive anger, aggressive anger, retaliative anger, anger that results in physical and verbal action towards others, and that can seem to come out of nowhere. That is rage. Another thing to be worried about is worry, is anxiety. Anxiety itself actually is a big factor for suicide, because when someone's anxious and they have panic or they have a swell of that adrenaline, it can cause them to not do things well, right? They just kind of are impulsive in that way when they are highly anxious. And the last thing in terms of mood on this chart is loss of interest, some apathy, some withdrawal from things they used to like to do, feeling they're just not connected and as passionate about things that they used to be. So these are some of the mood symptoms that we need to look for when it comes to warning signs for suicide in young people. The next one we'll cover is the green, which is the behavior. These are things that you see them doing or engaging in that makes you concerned. So related to loss of interest is withdrawing from activities. These are people who don't want to engage with things that they used to like to do. They may start giving away prized possessions or things they really enjoy because they are getting ready to depart the world. They may also have an increased use of alcohol or drugs. As we spoke about with teens, it's a very high risk of using drugs along with a suicide attempt. They may start to isolate from their friends and family or be more withdrawn, not just from activities, but from people themselves. They may have changes in their sleep, sleeping way too little or way too much. It really depends on the symptoms that they're having of an underlying mood or anxiety disorder. You might see behavior that is reckless or very impulsive, people that might do things that seem really out of character all of a sudden. You might see a behavior of aggression being really, as we talked about before, related to rage, these physical and verbal aggressions attacking other people. You may also see that they start calling people and saying goodbye, maybe even writing a suicide note. maybe even having meaningful conversations with people just to kind of get things ready for them to depart. And the last thing, one of the most important things, is they may start looking for ways to end their life, such as searching online for items or materials, purchasing things on Amazon, hoarding pills, looking for places to jump off of, or places to hang themselves. So these are called acts of furtherance. But really, when you see young people trying to look for things to do and ways to do it, that's very, very worrisome. And lastly, but most importantly, is the talk, is the things that people say that make us really concerned for suicide. They may say that they're experiencing an unbearable pain, a mental anguish, an inability to really be able to bear with life because of the emotional exhaustion. They may talk about feeling like they are a burden, that they are burdening others, they are weighing other people down, that they are just a stress on other people. They may talk about feeling that life might be better if they were not here because they cause such a burden on other people. Some people talk about feeling trapped, feeling like they cannot escape this life, cannot escape the situation. And others still will talk about having no reason to live, this hopelessness. And for me, as a psychiatrist, hopelessness is a very, very worrisome sign. If I have a young person who says they have nothing to live for tomorrow, that really is a strong worry for me. And lastly, they may overtly say they're thinking of killing themselves. So I think this is a great chart. It's a free chart. If you want to print it for yourself on their website, I would go there, print it, hang it up. I think these are great ways to just kind of in one arena have lots of symptoms that you look for. I would continue to look for these symptoms in your child. And if any of them come up, I want you to log it and see how often they come up, so that way can bring it to another provider, another professional that can help you help your child. Now, just in this slide, when we saw talking, mood, and behavior, I'm breaking up warning signs for you when you look for in your child as internal, things they experience on the inside may talk about, and external, things that you may see. So in teenagers, in young people older than age 12, the general group of symptoms that you'll see are pretty subtle sometimes, and other times can be very, very drastic. So the first thing will be eating changes and sleeping changes. Most adolescents will have changes in their food, in their diet, and in their sleep. So it might be a little bit tricky to figure out, is this really a big change or is this just a phase? You might see adolescents also developing symptoms of impulsivity, meaning they do things without thinking. And this may mean things like substance use, sleeping around, leaving your home late at night. These are kind of the things that might seem out of character for your child. So impulsivity is another warning sign that we have to look for. What very often brings parents to me is because they notice that their child has more arguments, is more angry, is more volatile with them, and just seems to be constantly on edge. And on the opposite end of that spectrum, there are definitely kids who also seem to just withdraw into themselves. They don't engage with family and friends. They don't talk. They don't seem to have much energy at all to engage with anyone, and they just stay in their room all the time. So that withdrawal from family and that anger, those are two different sides of the same spectrum, but they should both raise worry for you. Very often, the school will also see a change. They'll have academic decline, will not do as well in their grades, will not keep up with things. Some might even refuse to go to school. They might just say they want to stay home and not go at all. The other thing is that very often teens will dabble in substance use. It is not uncommon now that marijuana is being legalized, that vaping nicotine is pretty prevalent. Very often teens will try substance use here and there. But if the substance use is impacting their life, if it's impairing their functioning, if they are going to school high, they're coming home and they're getting fights, with you and her siblings because they're using, if they're choosing not to hang out with friends or do things because they'd rather be home and get high or use Nick, these are all warning signs for potential suicide. Very often, substances, as I said before, can be like liquid courage. They can give you a disinhibition and you have a little bit more bravery to try things you might be scared to do, like trying to get under your life. And last but not least are suicide notes. If you find suicide notes, if you find drawing of dark things, if you find them expressing thoughts about not wanting to be alive, please, please, please do bring this to a mental health provider. I remember I had a child who I was seeing for anxiety, and I spoke to the child alone, and I was concerned for suicide. And she would not tell her family, she would not tell her mom or dad. So they didn't believe me when I told them that this child is having suicidal thoughts. We really need to make sure that we properly treat her, make sure we're doing the right safety precautions, taking her to a therapist. Months later, they found a suicide note. So it's only until they saw the suicide note did they believe that I felt that she was not just anxious, she also had some hopelessness, some depression. And from there, they did take it more seriously and escalated it. But, when we see that kind of evidence, them actually putting it down on paper, that just makes it all the more real. So please do take it seriously. Now, internal risk factors, internal warning signs that you may see and that they may describe are symptoms of that diagnosis that I was talking about. If they have increased symptoms of depression, anger, anxiety, numbness, these kinds of symptoms all can be signs of impending suicide. So please do observe for any of these changes and bring them to a specialist. They may also have lack of enjoyment in activities that they loved before. They may be overthinking or thinking more about death and dying. It keeps coming up in their discussions. Very often, young people will have an increased use of electronics. They will indulge even more than usual and use that as their main form of communication with their peers. I know there is a level of typicality with this in the Gen Z generation, but for those who have impending suicide, you may find that they will post things online. So you should be monitoring their social media accounts and see what they are posting and who they are engaging with, just to be sure they're not sending messages somewhere else that you can't see that they are thinking of suicide. Last but not least is this feeling of a burden, where they feel that whatever they do, no matter what they do, they're just stressing everybody else out. So it's better if they're just not alive. So these are some of the top warning signs that I want you to think about when you are assessing and looking for suicide in your 12 and above. So 12 to 18, typically, okay? Now for 12 and below, it is similar, but there are a couple of differences. So for those younger than 12, they may not have the verbal ability to express how they truly feel. They may not have the cognitive ability to understand how certain factors and stressors in their life may be pushing them towards not wanting to be alive. So in addition to eating changes and sleeping changes, for these kids, you may actually see increased anxiety. They may seem far more stressed out than typical. Again, you may see the academic decline and the school refusal and the impulsivity, but with this increased anxiety, with this increased feeling of dis-ease, they may also be clinging to parents. They may not want to sleep alone in their bed. They may want to see their parents all the time and not be away from them, kind of like a resurgence of separation anxiety. This is very common in younger kids who are really concerned that they may try to take their life. Again, with this, you might also see increased anger and aggression and arguments with their parents. The internal symptoms include what we talked about before, this preoccupation with death and dying, this lack of enjoyment, feeling like a burden, feeling like alone, very common. But it's much more common that younger kids younger than 12, will also have a lot of physical symptoms, somatic pain symptoms. So this includes things like headaches, stomach aches, upset stomach, vomiting, cyclical vomiting. But upset stomach and headaches are very, very common. They may even have muscle aches or joint pain. It's inexplicable. So somatic pain is a very common way of expressing suicidal thinking and worsening mood. And last but not least is voice hearing experiences, or what other people call hallucinations. It is very, very common for people who have high anxiety, especially under the age of 12, to experience this anxiety as something they hear or something they see that's not there. And of course, when they do hear or see that thing, they get more anxious. So it does not mean that they're psychotic or have schizophrenia. Usually under 12, hearing voices or seeing things really means high anxiety. And very often These are young people who might want to try to end their life because they see these things, feel these things, and they're very frightened about it and are confused. So if your child is bringing these things up, please do, of course, bring them to a mental health care provider. But the biggest warning sign is suicidal statements. If your young person, your loved one, is saying things that are suggestive of suicide or around suicide, and I'll bring some of those things up a little bit later in the module, don't let it go. Please, please, please. I'm going to teach you how to inquire in the next module, how to ask these questions and really tease it out. But I want you to take it seriously. And please bring this to your mental health care provider and assess and maybe even call crisis if you don't know what to do. Okay. So suicidal statements, we don't want to let that go. Now, this chart we had talked about a little bit before in terms of thinking about the suicidal ideation and how it progresses to suicide attempts. But there are some symptoms before. Very often, but not 100%, very often before a young person develops suicidal thinking, they have a mental health diagnosis, which is something in the DSM, which is our mental health kind of guidebook that helps us understand criteria for mood disorder, anxiety disorder, which we also talked about before. In a diagnosis, these shifts or warning signs that we just talked about persist. Hopelessness persists. Irritability persists. Feeling like they're a burden persists. So those are things that we do incorporate to help us understand if a young person does have a diagnosis. But teenagers are dynamic and they are growing. So oftentimes teens will have emotional phases. These are changes that do come and go, and they could be worrisome. And if there's certain things like suicidal statements, we escalate. But other things like anxiety, we may need to wait and see how the pattern of that does emerge and whether that does develop into a diagnosis or a more serious thing like suicidal thinking. So where do these warning signs happen along this spectrum? Well, they can happen anywhere. They are less frequent during the emotional phases and the diagnosis phase, but as you get closer to an attempt, these warning signs do increase in frequency and severity. So the more depressed, the more anxious, the more hopeless a young person gets, the more you will see these warning signs. So you may see more of them pile up together, or you may see one increase in intensity and in frequency. But the thing is, as I said before, how do you know if this is just a pattern that's new, a blip, trying out a certain emotion, experiencing some stress, if it's teenage angst, or if it really is truly a warning sign for suicide? It's a tough question, right? And as psychiatrists and as pediatricians, we will really work to assess your child, not just by talking to your child, but talking to you, because you observe things on the outside that's really valuable for us to know to help ascertain level of risk and whether this really is a diagnosis or not. So that's how we figure it out. We get a history from you. So your history, your child's endorsement of symptoms, certain rating scales, and kind of knowing and understanding how emotional phases may go for certain age ranges and how a diagnosis may go for certain age ranges. These are things that really are challenging to sort out, but I'm going to give you some tools right now to help you, help us figure out, is this an emotional phase or a diagnosis? Because I think as a parent, that's a really hard and tall order for you to figure that out. But that's why the focus is on identifying the warning signs. And now we're going to talk about identifying certain patterns to help the professional figure out how severe it is, okay? So how do we know if it's a phase or a warning sign? I have created this acronym called FIND. I want you to find the change. And the F stands for frequency. The I stands for intensity. The N stands for the number. And the D stands for dysfunction. So this is on my website. If you've looked at it, you might have seen this. And the example I give is oversleeping. Let's say you have a child that just seems to sleep all the time. You don't know why. They seem to have had it for a long time. If you recall, you don't know when exactly it happened, but they're definitely sleeping way too much. So in terms of frequency, You log how often does it happen that they sleep excessively? What does that mean excessively? Is it only on school days? Is it to avoid school? Or is it also on the weekend? Is it when they're trying to avoid a social gathering or trying to avoid going to grandma's house or dad's house? So you want to try to track how often does it happen, that is frequency. Then there is intensity, which is how severe, how strong is it? It's almost like, the strength of this sleep difficulty, the strength of the symptom. So you want to also find out how long it has occurred for. And when it does occur, how bad is it? So is this a child who's sleeping 24 hours? Is this a child who's sleeping for 12 hours, but they're just awake at night and asleep during the day? Is this a child sleeping for maybe 20 hours, is only up for 4 hours? So that's what we mean by intensity, understanding how strong the symptom is. Then we go to number, which is a little bit different than frequency, and I'll talk about that in a bit. But we want to understand not just how often it happens, which is frequency, but when it happens, are there clusters? Are there a number of things happening all together, episodes happening all together that make you concerned about when it happens? And that contributes to intensity. So if it's for sleep, you want to ask, how many days in a row of excessive sleep is there? If it happens, again, when does it happen? And is it more likely to happen when there's school or when there's no school? And does it happen in groups? Do you find that maybe the beginning of the month, there's only one day that she sleeps excessively, but at the end of the month, maybe around her period, she is sleeping several days in a row? So these are the things we want to sort out, and the difference between frequency and number. And then dysfunction. Dysfunction is really important because this is this change impacting their life in a negative way? Is this change causing them to not want to engage in things that is very typical, like they're sleeping in school, like they're sleeping all the time, like they're running around outside and fall flat on their face asleep? Is it functional, where they're sleeping, but they're still able to get their work done? They're still able to get up, go to school, go to their day job, babysit at night, and then they still oversleep, but they will do the things they need to do. So figuring out if it's dysfunctional and impairing their life is really another key signal to let us know, is this more of a diagnosis or something that is sticking? Or is this something that's just a phase? So there it is in a little bit larger size for you, that the frequency, intensity, number, and dysfunction, these are the words that are fitting for the acronym of FIND, to help us sort out, help you as the parent sort out, when you see a change in behavior or you see one of those warning signs pop up, I want you to find for that warning sign to help us understand, is this a problem or not? And as I said before, with frequency, this is how often it happens. With intensity, you can actually use your SUDS, which I taught you back in the pre-workshop. How severe is it on the units of distress for this person and from your perspective? And then the number is, are there clusters? Are there episodes? Are there things happening back to back that make you concerned? But again, the biggest warning sign is suicidal statements. So for suicidal statements, you don't necessarily have to go and do FIND. That would be automatic, go and talk to a mental health care provider if you don't have things in place. But for the other symptoms, I would definitely use FIND. And, even if your young person has been saying suicidal things for a while, it could be helpful to use FIND for this as well, because there might be certain patterns that provoke suicidal statements. Okay, so our recap for the Find the Change. How do we know what's normal? What may be a diagnosis versus a phase? I want you to ask yourself, whatever warning sign has popped up, hopelessness, anhedonia, aggression, excessive sleep, poor eating, whatever change you've seen, I want you to ask yourself the FIND questions, the frequency, intensity, number, and dysfunction you observe in your child within a span of 2 weeks to 8 weeks, so 2 weeks to 2 months. And if it is substantial, and if there is a dysfunction, I want you to make sure you bring this to a mental health care professional. Make a log of all of the find symptoms that you find and see if you can share that with the mental health care professional or your pediatrician, because we're going to ask these questions anyway. And if you're able to kind of start with these answers up front, it really helps us to be very efficient and effective and dig even further so that we really understand the full picture. So for our bullet points, remember, in terms of suicidal warning signs for youth, there are external signals and there are internal signals. In children under the age of 12, they are more likely to have high anxiety and clinginess to parents, as well as physical symptoms and even hallucinations. So watch for these things in kids under 12. They are not the only signs that are warning, but those are significant signs in frequency. Over the age of 12, you are more likely to hear that teens have made suicidal statements or even action. So please take those very seriously. You may see more anger outbursts as well as substance use. And if the substance use is impairing and impacting their life, this is also a warning sign. The biggest warning sign for a suicide attempt are suicidal statements, stating that they don't want to be alive, stating that they no longer want to be here, those kinds of statements, which I will cover next. These are the things to really watch for and should be a huge red flag for you to bring to a mental health provider. Parents can help medical providers identify whether something is just a phase or a diagnosis by using the acronym FIND. When they see a warning sign, use FIND to help figure out how severe the symptom is. Does it stick? Does it not? And again, bring it to a mental health care provider. And if any of these changes that you see is dysfunctional, it is really imperative that you seek extra help. So these are the things that are warning signs that we have to continue to look for in our children to make sure that we keep them safe and protect them against suicide.